Actions of LCWS for the COVID-19 response. The coronavirus, which was first diagnosed in the Wuhan city of China in December 2019, spread rapidly around the world. On 23rd January 2020, for the first time in Nepal, it was confirmed that a Nepali student who had returned from China was infected with COVID-19. With the increase in the COVID-19 infection, panic started spreading in the local community and it started having more socioeconomic effects in the country. Due to the nationwide lockdown, traffic was disrupted. As a result, local people who had traveled far in search of work were unable to return to their homes. As commercial and economic activities remained closed, the families who depended on daily wage labor for their livelihood began to face more complicated programs. Due to the lack of necessary preparations and the resources at the local level, it was not easy for the local government to manage the infected people and minimize the effects of COVID-19. In order to prevent and control the short-term and long-term effects of COVID-19, the LCWS has been implementing COVID-19 response project with the financial and technical support of the LWF Nepal. Action 1. Public awareness programs for prevention and control of COVID-19 infection. Radio message in local language was broadcasted in Jhapa and Morang for the prevention and control of the COVID-19. In addition, public awareness-related SMS were sent to the mobile phones of the local community members. Flexes, banners, and the publications were distributed with messages such as washing hands frequently with soap and water, using a mask, maintaining social distance, covering the mouth with the elbow when coughing or sneezing, and going to the nearest health center for testing in case of symptoms of COVID-19 to avoid the more infection. The digital displays were constructed in local isolation centers to inform the local community to prevent the spread of COVID-19. It is projected that more than 25,000 general public received messages through such kind of public awareness programs.
धनपाल थान गाउँपालिका 7वटै वडामा 18 वर्षदेखि माथिका सबै उमेरका व्यक्तिहरूलाई कोभिड-19 को खोप लगाउने कार्यक्रम सञ्चालन भएकोले आफ्नो स्थानमा कोभिड खोप भ्याक्सिन लगाउन हुन विनम्र अनुरोध गर्दछ। आयोजक धनपाल थान गाउँपालिका। सूचना।
Action 2. Emergency relief material, food and non-food distribution program. With the spread of the COVID-19 epidemic, the government of Nepal announced a nationwide lockdown, due to which the community members who depended on daily wage labor were struggling. Due to the closure of transportation, factories and industrial business, the daily life of the employees working there was affected, and the family's regular source of income was lost, which led the food crisis among the poor and oppressed families. Considering the risks of such kind of food crisis, the LCWS distributed food and non-food items as a relief, and 733 households, including 3,140 family members, were directly benefited through the emergency relief material distribution program. For the relief distribution program, targeted beneficiaries were senior citizens, single person, lactating women, pregnant women, PWDs, and laborers trapped in the workplace due to the lockdown. Action 3. Conduction of capacity building programs. Training was provided to the local HRDs on what procedures should be adopted to bring justice to the victims through the judicial committee of the local government and the related agencies in order to minimize the incidence of sexual and gender-based violence in the community during the pandemic. In addition, orientation was provided regarding child rights, human rights, and women rights. Psychosocial counseling trainings were provided to local health workers and volunteers. Because of this, health workers and the volunteers have become aware of the method to be adopted to minimize the mental stress and the impact on community members during pandemic and disasters. In total, 470 health workers and the community volunteers were directly involved in such capacity building related trainings.
कोभिड को समयमा लुथरनले हामीलाई धेरै नै सहयोग गर्नु भएको छ। हामीलाई कोभिड को समयमा चाहिने सामग्रीहरू वितरण गर्न दिनु भएको छ हैन। अनि हाम्रो स्वास्थ्य कर्मीहरूलाई चाहिँ मनोचिकित्सक सम्बन्धी ट्रेनिङ पनि दिनु भएको छ उहाँहरूलाई हैन। कोभिड-19 भएका बिरामीहरूलाई चाहिँ कसरी काउन्सिलिङ गर्ने हैन, कसरी हेर्ने भन्ने कुराहरूमा उहाँ लुथरनले चाहिँ तालिम दिएको थियो हाम्रो स्वास्थ्य कर्मीहरूलाई। र हामीलाई पनि स्वास्थ्य शाखामा धेरै सामानहरू चाहिँ दिनु भएको छ हैन। त्यो सामानहरू हामीले प्रत्येक हामीसँग 7 वटा स्वास्थ्य संस्था छन्। ती सबै स्वास्थ्य संस्थामा माग अनुरूप सबै सामानहरू बाँडेर दिएका छौँ र त्यही सामानहरू अहिलेसम्म पनि हामी लुथरनले दिएका सामानहरू प्रयोगमा ल्याइरहेका छौँ। जस्तै ह्यान्ड वासहरू हैन, ग्लोभ्स, सेनिटाइजर, मास्क, यी कुराहरू चाहिँ ले धेरै नै कोभिड रोकथाममा धेरै ठुलो सहयोग पुगेको छ।
In addition, 16 days campaigns against sexual and gender-based violence were also organized in collaboration with the local government to spread public awareness against gender-based violence. Action 4. Health Service Empowerment Program. To address the shortage of necessary resources in local level and the provincial level hospitals during COVID-19, medical items were distributed such as masks, PPE sets, gloves, sanitizers, thermal guns, oximeters, etc. Various medical supplies including UPS inverter, oxygen concentrator, machines were provided to Koshi COVID Hospital located in Biratnagar. Similarly, the BiPAP ventilator machine for use of the health treatment of newborns was provided to the Koshi General Hospital of Biratnagar. As a result, it was easier for the hospitals to provide health services during the COVID-19 pandemic. Similarly, the local and the provincial hospitals were supported for establishment of help desks and the mobilization of volunteers with toll-free number. The local government also have supported for COVID-19 vaccination programs. More than 18,000 community people have been directly benefited through such health services empowerment programs.
विगत यसपालिको कोभिड-19 महामारीमा लुथरनले हामीलाई धेरै सहयोग गरेको छ। विभिन्न मेडिकल उपकरणहरू, भेन्टिलेटर, मास्क, सेनिटाइजर, बाइपाप मेसिनहरू, त्यसपछि लिएर ग्लोभ्सहरू सहयोग गरेकोले हामीले कोभिड-19 को उपचार अथवा यसको नियन्त्रण कार्यमा ठुलो सहयोग भएको छ। र हाल त कोभिड महामारी कम भए तापनि त्यस उपकरणहरूको उपयोगिता अहिले पनि जारी छ र हामीले आइसियुमा तिनै उपकरणहरू मध्येबाट केही प्रयोग गरेर हामीले आइसियु सञ्चालन गरेका छौँ र यसको लागि लुथरनलाई धेरै धेरै धन्यवाद र भविष्यमा पनि यस्तै सहयोगको अपेक्षा हामी गर्छौँ। हामीलाई पहिला नेपाल सरकारलाई नि अब मेडिकल इक्विपमेन्टहरूको धेरै खाँचो थियो। यो विश्वव्यापी महामारी भएकोले चाहिँ धेरै खाँचो थियो। यस्तो बेलामा चाहिँ लुथरनले हामीलाई सहयोग गरेर ठुलो गुण लगाएको छ।
Action 5. Enhancement of WASH Facilities Program. Understanding the reality that personal hygiene and sanitation, access of water point is essential to prevent the spread of COVID-19. The LCWS provided support for the construction of hand washing stations at local government offices and health posts. Apart from that, at the community level, dignity kits containing cleaning materials such as toilet paper, soap, baby wipes, sanitizers, sanitary pads, etc. were distributed to 211 households. In overall, more than 10,000 people and the community peoples have benefited through the Enhancement of WASH Facilities Program. In addition, assistance has been provided to improve students' access to drinking water and sanitation in 10 schools in Jhapa and Morong districts, from which more than 900 students have been directly benefited.
नमस्कार, मेरो नाम चचिन्ता मर्डी। म चाहिँ यो यसै विद्यालयको शिक्षिका। यस विद्यालयमा चाहिँ पहिला खानेपानीको अभाव थियो। LCWS बाट यस विद्यालयमा खानेपानीको सहयोग भएको छ र यहाँ चाहिँ मोटर जडान गरिएको छ, साथै पानी ट्याङ्की रहेको छ र त्यसै साथै धाराहरू पनि जडान गरिएको छ।
Action 6. Restoration of means of livelihood. Due to the impact of the lockdown announced by the government of Nepal and due to the COVID-19 epidemic, there was a huge impact on the community level. Daily wage workers and the employees working in industrial factories lost their jobs. Community members who went to India to work have to face many challenges to return to their home. The small business of local people collapsed, and due to the loss of contact with marketing, agricultural products damaged in the fields and were wasted. Due to the return of migrant workers from outside, sexual and gender-based violence also started to increase. In order to address such problems and challenges, cash distribution program and rehabilitation of small business have been carried out. Because of such programs during the lockdown, families who survived by taking loans from groups and the cooperatives whose business were destroyed have been helped to rehabilitate their business, and the food security of community members has been increased. In total, 300 households, including 1,350 family members, have been directly benefited through such livelihood rehabilitation programs.
40 वर्ष लालो मण्डल 40 वर्ष हो अनि उताबाट पाए टेबुल कुर्सी अनि दोकानको सामान पाए अनि त्यही दोकान गर्दै छु खाँदै छु छोराहरुलाई पनि पढाउँदै छु अलि सहयोग राम्रो भयो व्यापार मेरो कति 16 लिटर दुध बिक्छ।
नमस्कार, मेरो घर रङ्गेली 1, मेरो नाम सरिता शाह, बबिया बिर्ता घर हो। म तरकारी खेती गरिरहेको छु र जहिलेदेखि यो लुत्रन समूहबाट चाहिँ हामीले यसरी सहयोग पाएको छौं। बिउ बिछन खाद मल पनि पायौं, सिँचाइ पनि पायौं, बोर्डिङ मेसिन पनि पायौं, टोनेला पनि पायौं हामीले बिउको राख्नको लागि। अनि हामीलाई समय समयमा तालिम पनि पाइरहेको छौं। अनि यसो सरहरु पनि कता कता बाहिरबाट आइरहनुहुन्छ हेर्नलाई के कसो गरेको छ कि छैन भनेर पनि हेर्न आइरहनुहुन्छ र हामीलाई चाहिँ यो तरकारी खेती गरेर धेरै जाँगर लागिरहेछ र तरकारीबाट नै हाम्रो उत्पादन राम्रो भएको छ, घर व्यवहार राम्रोसँगले चलेको छ र छोराछोरी सबैलाई पनि पढाउन राम्रोसँगले गरेको छौं। अनि हाम्रो बजार चाहिँ यहाँ आज नजिकै हो, बिर्ता बजार। अनि हामीले चाहिँ सब्जी आज नजिक छ, सबैजनाले लगेर बेच्छौं राम्रैसँगले।
Action 7. Conduction of Interfaith Workshops for Emergency Response. Since a disaster or a pandemic may affect to any caste, gender, religious group, and everyone is equally at risk, so to strengthen the interfaith networks to fight together against such disaster and pandemics, in collaboration with Interfaith Peace Federation Nepal Province 1, various level of workshops have been organized, through which a province-level DRR and emergency response forum has been established in the presence of religious leaders like Hindu, Muslim, Buddhist, Christian, Baha'i, Quinath, etc. And operational guideline of that forum has been developed. Through this program, religious organizations and the religious leaders will unite and cooperate and coordinate during the pandemic in the coming days and show solidarity for disaster response during emergencies. Thank you.